These antibodies may be a marker of therapeutic failure for the opioids themselves. And so to harken back to the hyperalgesia question, that's only one of several negative outcomes that could occur, right? One of the other negative outcomes that occur is just increasing doses of opioids while having reduced efficacy, for example. And so these antibodies could point to and provide support for physicians and other healthcare providers to help their patients transition off of opioids and onto other long-term pain treatments that we know have better risk-benefit profiles over the long term, such as non-steroidal anti-inflammatory drugs.
One thing that we noticed, right, was that it was the recent daily dose that was correlated with the response. And so there are a variety of opioids themselves that aren't structurally related. And so one potential outcome could be that, if someone, needed to be on opioids long term, switching between these unrelated opioids, for short periods of time could be more helpful than, for example, staying on hydrocodone or oxycodone for 20 years.
We've been trying to develop a new therapy for triple-negative breast cancer, which is a really aggressive form of breast cancer and one that's very difficult to treat. The reason it's difficult to treat is that it's missing a lot of the key receptors that normal breast cancers have, or many breast cancers have, including estrogen, progesterone, and HER2 protein receptors. As a result, it's very difficult to target this particular type of cancer. This accounts for up to 20% of all new breast cancer cases each year. And one of the problems with it is it's highly metastatic, which of course leads to death in many cases. It's more common in African American women and women under 40. And there are no known tumor-associated antigens. New antigen sources are needed in this case. And the antigen is again, the marker that we're ultimately trying to target and develop in any sort of therapy. The way we're doing this is to trying to create effectively a vaccine, a type of immunotherapy that stimulates the immune system and trains it to selectively eradicate disease. Cancer in this particular case. And we found that how you package these components can have a huge impact on how the immunotherapy works. 6 of the 9 animals were cured, and the other 3 animals had significantly extended lifespans. So that's really exciting, not just retarding tumor growth, but completely curing the disease. Now, this isn't curing triple-negative breast cancer. This is curing it in animal models. And so the next step in this case is moving towards animal models that are more representative of human forms of triple-negative breast cancer. These were mouse forms.
We have an ongoing project now for many years to try to evaluate the body burden, so the plastics that get into the human body, because we know that they are in the environment, they are in our food, and so it is important to study how much of that material makes it actually into our tissue, not just into our gastrointestinal system. The key findings for us are that we have introduced a method for detection of nano and microplastics, as well as a new tool of reporting those results, which is direly needed, as we see a lot of reports with units that are ambiguous. Again, I don't want to make you afraid of plastics, but I'd like you to ask people to give you smarter plastics, safer plastics.
These microbes that we have studied so far are the microbes that are naturally present in seawater. But if you live in a coastal environment like we do, there's also sewage and raw, sort of raw sewage, pollutants. There's a lot of microbes that humans are adding, which is modifying the composition of the seawater and in turn modifying the composition of the air. So we've been looking at the viruses and bacteria that get launched into the air in the surf zone. When we had this pandemic start, this is the SARS-CoV-2 that leads to COVID-19, people detected it in sewage. And so we were looking already at the water, and so we decided to take a deeper look at the water in this sort of estuary, which I'll show in a second, look at the ocean water and look in the air. The big question that NSF funded was, do we find SARS-CoV-2 in the water or in the air in the natural environment? What I'm going to report on today is results that I'll talk about this afternoon, but results where we actually looked in all of these locations to see if we could actually detect the presence of SARS-CoV-2 getting out in the sewage. Microbes don't want to be in the ocean, so they sit on the very top surface of the ocean. And so when waves crash, they launch large amounts of, whatever's sitting on the surface. So bacteria, viruses, and we've been looking at that for the natural microbes that are present in the ocean, but now we're starting to look at it thinking of what extra microbes do we see in the air and what are the health implications.